using some of the terms we learned. So I'll give you a couple minutes to work on this, and then we'll go over it. For those of you just joining us, we're working on this problem on the board. And I'm going to start to do a little drawing in the corner as you finish this up. Okay, so what I've drawn in the corner is a very terrible drawing of a person. So this at the top is supposed to be the head with our airways from the nose and mouth respectively, going through the conducting zone, right? So we go through the pharynx, the larynx, the trachea, out to our primary bronchi, and then into the lungs where we'd have more divisions, right? So we immediately know, given in this problem, we have some pressures, right? So the first pressure we have is our absolute atmospheric pressure of 761. So we start out in the environment, right? Our atmospheric pressure we know is 761, but we're trying to get to relative pressures And so we know that the way we do that, right, to get from an absolute pressure to a relative pressure is we're going to be defining all of our pulmonary pressures with respect to that atmospheric pressure. So we have to set it equal to 0. So we're going to subtract 761 from all of our pressures. So our new, and I'll put it in parentheses, our relative pressure here is in parentheses. Our new atmospheric pressure, we're setting equal to 0. So we did 761 minus 761 to get a pressure of 0. So that's out in the environment. The second pressure we're looking at, and I'll draw, I do have the option for an arrow, how nice. Okay, so the next pressure is the pressure in the alveoli. So we start out with our alveolar pressure. What did I tell us it was? Okay, 759. So our absolute pressure is 759. To get our relative pressure then, we're going to do 759 minus that atmospheric pressure from before, so minus 761. Okay. So that is equal to -2. Okay, so -2 there. Trying to make it big enough so it's all on one line. Let's see if I can make just that color. No, I can't. Okay, -2 is our relative alveolar pressure here. So our final pressure that we're looking at is the intrapleural pressure. So we know that that's the pressure in this space, right, between the chest wall and the lungs. So in this space where our visceral and parietal pleura are rubbing up against each other and we have a little fluid. So that pressure in that space, we start out with our PIP equal to 755. All right, so that is our absolute pressure here. But again, we want a relative pressure. So we're doing 755 minus 761, okay, which is giving us a pressure of -6. Okay, this will go to the next slide. All right, so that is our relative pressure, -6 here, for our intrapleural pressure. So that's how we get from absolute pressure to relative pressure. Next question asks us what the transpulmonary pressure is. So our transpulmonary pressure, I'll start doing some math over here. Hopefully you guys are writing these on a fresh piece of paper, but I'm just gonna be scribbling in our margins. All right, so our transpulmonary pressure, or the distending pressure across the lung, is equal to our pressure in the alveoli minus our pressure in that intrapleural space. So that's our definition for transpulmonary pressure. Okay, so we're going to put in our numbers. All right, so we have our alveolar pressure. Let's use the relative pressures because usually this is going to make the math a little easier, right? So we have -2 minus our pressure in the intrapleural space. So we're doing minus -6, right? So that's equivalent to -2 plus 6, which is 6 minus 2. So our transpulmonary pressure here is 4. Our final thing we want to know here is whether this is going to create inspiration or expiration in this situation. So there are a couple ways we can do that. One thing we know is that the transpulmonary pressure is usually at -4. So the fact that it's at -6, we can tell something's happening. So that might give us an inkling that something's happening with the chest wall, leading to movement in that chest wall. But the easiest way to do this, and the way we really want to focus on, right? So we know that what we have to do is compare the atmospheric pressure to the alveolar pressure, right? So all we're looking for is the atmospheric pressure greater than or equal to the alveolar pressure. So is it greater than or equal to the alveolar pressure? This is what's going to give us our definition. And so we see that our atmospheric pressure is 0 and our alveolar pressure is -2. So the atmospheric pressure of 0 is greater than -2. Okay. So based on this, we know that air wants to flow down its pressure gradient. So it wants to flow from higher to lower, right? So we can think of that caret there, right, as an arrow pointing in the direction the air is going to flow. So our air would be flowing, blue, there we go. So our air is flowing from this higher pressure of 0 towards this lower pressure of -2 in the lungs. So this is our definition of inspiration. So we're breathing in. You could also potentially tell that if you're being really sneaky from this drawing I drew. So at the bottom here, you can see that I drew my diaphragm as flat, right? So I drew this diaphragm as flat because I was drawing a contracted diaphragm for us. So contracted means that when that diaphragm tightens, it pushes down on the abdomen. It usually has a dome shape. So in labs yesterday, for some of the groups I talked to, right, I pulled a little on the edges of the diaphragm for us so that we could see how that would create this pressure pushing down on the abdomen. If you're not in my lab section, I recommend either thinking that through or actually going and trying it yourself a little bit in the lab during review hours, and appreciating how that would create more space in the thoracic cavity, less space in the abdomen, allowing room for the lungs to expand. Okay. So questions, of course, I just erased all that, but questions about this problem before we move forward? Okay, seeing no questions. So just to let you know, I'm not going to ask you directly to do math on the exam, but you should be able to compare these relative pressures to be able to determine whether we're going to have inspiration or expiration. And I always find it easier to kind of actually go back to those equations to just kind of check your gut on those. Okay. So when we left off, our next topic that we were getting to was the mechanics of breathing, right? We were talking about the forces for ventilation, and we know ventilation is the movement of air. So we had talked about some of these equations, right? We talked about these pulmonary forces, the atmospheric pressure, the alveolar pressure, and the intrapleural pressure. We'd looked at how we could relate these pressures to each other. And we saw that basically what we're going to be changing in order to move air back and forth is that alveolar pressure, right? We don't usually change the atmospheric pressure. You can't control the air around you, right? You know, you can't bunch it up with your hands. It's not how air works. So what we're going to be changing is the alveolar pressure. And now we're going to talk a little more about that. So we know that the force for airflow is the pressure gradient, right? And a gradient is just where you have two different pressures, and we want flow to happen from high to low. So if we look at our exact equation for the flow, I'm just gonna circle, right? So this flow equation is very similar to our flow equation for our cardiovascular system, right? We have flow equivalent to a pressure difference. In this case, our pressure difference is the atmospheric pressure minus the alveolar pressure, right? Before we had our pressure of arteries versus pressure in veins. Now we have our pressure of the atmosphere versus pressure in the alveoli. And we can see that our resistance will also eventually come into play here as well to determine flow. In order to understand fully what's going on here, though, we're going to need to dive a little deeper in on this pressure in the alveoli. So we're going to talk about something called Boyle's law. What Boyle's law basically comes down to is that pressure is inversely related to volume. So we can express that like pressure is inversely related. Equal sign is not quite correct. Hold on. So related, so this is kind of like an equal sign, but it tells you there's other stuff going on. So our pressure is inversely related to volume. Okay. So we're going to be able to change alveolar pressure by changing the volume. So there are other things that would determine exactly what the number for the pressure is. There are a bunch of constants in Boyle's law. But what we really want to focus on for our purposes is the fact that as we change volume, right, we're going to see an effect on pressure. So basically, as we increase a volume, right, as we increase a volume, drawing an up arrow next to the V here. So if V gets bigger, we're dividing by a bigger number. These are inverses of each other. So as we increase volume, pressure will go down. And the reverse will also be true. So I'm going to grab us another color. Let's use some pink. Okay. So if volume goes down, right, if volume were to go down, so if our alveoli get smaller, our pressure will go up. So we're going to be able to change the alveolar pressure by changing the volume of those alveoli due to this inverse relationship. We're also going to talk about resistance to airflow in a little while, but we've seen before that air resistance is related to radius. Now we're going to have another factor to consider as well, the mucus, right? And we have a couple new things, but a lot of familiar things as we're talking about the mechanics for breathing. This is just a slide showing us in a little more detail the relationship between our volume and pressure. So we can see this equation at the top, our ideal gas law equals PV equals nRT. And we can actually reformat that to get back to this relationship with volume that we're interested in, right? So if we rearrange the equation, right, if we take PV equals nRT, means it would be the same equation. If we then divide everything by V, we would get P equals nRT divided by V. So actually that nRT, right, that's what we are expressing as a 1 in the equate that inverse relationship that I wrote on the board on the previous slide. Right. Our N here is the number of moles, R is our gas law constant, and T is temperature. So we can kind of wave our hands and consider this term to be roughly unchanging for our purposes when we're thinking about airflow. But if we wanted to calculate the exact pressure, this is how we would do it. But we can see that that same relationship is really coming from that ideal gas law. Okay. So in the drawing, we could see how this happens, right? Pressure is basically stuff inside of something pushing out on the walls around it. So here we see our gas molecules in a container, right? So we could count them up: 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. So here we have a volume of 1. So let's say our volume here is 2. We could see our pressure is 1. All right. As we compress this container, right? So we make it smaller, right? It's getting shorter. We're actually not changing the number of gas molecules here. If you count them up, you'd still get 15, right? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. But because they're in this much smaller volume, right? We've gone from a volume of 2 to a volume of 1. As they move around, they bump into the walls of this container more. They exert more pressure out, therefore, right? They're more compacted. So there's kind of a force stored in that concentration of molecules. So we see that as the pressure went down, as the volume went down, the pressure went up. Right? So volume and pressure are inversely related, so we can think of them kind of as opposites. We kind of thought about this in our previous units on our vasculature and on the heart, right? This is just expressing this a little more in detail in numbers. So we have some determinants of intraalveolar pressure, so that pressure in the alveoli. So basically we have things that are going to be determining the volume and also playing a little bit with the number of molecules inside, right? So in this, I thought I was done with this slide, but it turns out I was not. And so in this equation, we were showing two containers where that N, the amount of gas inside, stays the same, right? But if we were to change that volume, if we were to change the amount of air inside, right? We said that PV equals nRT can be rearranged such that P equals nRT divided by V, right? So one thing we can get from this, right, is that pressure is inversely related to volume. But another thing we can see, right, is that if we were to hold a volume constant instead, right, we'd see that pressure is directly related to nRT. You don't have any division. So it's directly related to N, which is our number of molecules really inside the lungs there. So we can see here if our volume is staying the same, that's why it's not in this equation, right? So if we were holding volume constant, we wouldn't need to worry about what we're dividing by. So if N goes up for the same volume, that means P goes up. So this is all very specific to if we hold the volume constant, but increase the amount of stuff in there, that pressure goes up. Because that would have the same effect essentially as decreasing the volume does, right? So if I were to increase the number of molecules in this big container, right, we'd see that we essentially have that same situation as in the right-hand side in the small container, right? We now have a more concentrated situation with these molecules, more of them bouncing off these walls more. So they would then be exerting greater pressure just by the fact that there's more of them. So conversely, if we decrease the amount of air, we would also decrease the pressure for a given volume. So both of these come from this ideal gas law, but we can also kind of internalize these by thinking about what's really going on with the molecules and the size of the container, and therefore the walls of the container. So we're going to be looking at the quantity of air in the alveoli, which is basically going to be like N in that equation. We're also going to be looking at the volume of the alveoli, the volume being the size of the container. So from that ideal gas law, we'd be looking at V. Okay, so we're going to be able to change the amount of air in the alveoli, and we're going to change the volume or the size of the alveoli. Both of those are going to have effects on pressure. So basically, as the lungs expand, as the lungs get bigger, our alveolar volume increases because the lungs are mainly made up of these alveoli, right? Again, if you go into lab, I recommend that everybody touch the lung and squish it a little bit between your fingers. You will feel that it really does feel just like a sponge because of all these alveolar sacs, because of these little bubbles in the lungs. It's really cool. Okay. So as the lungs expand, right, as they get bigger, what's happening in the alveoli, right? If we have our alveolus like this, as the lungs expand, the alveoli themselves expand, so they get larger. So if we imagine, like in that previous image, right? Well, let's just draw in 3 little air molecules here, right? So as this container expands, our 3 little molecules now have way more room. So they were exerting a certain amount of pressure in this first situation, and now they're exerting less pressure in the second situation because they're more spread out, essentially. So as the lungs expand, as those alveoli get bigger, our alveolar pressure is going to decrease, right? We know that inhalation versus exhalation, or inspiration versus expiration, is driven by a pressure gradient. So if our alveolar pressure goes down, right, and we're comparing, is our atmospheric pressure greater than or less than our alveolar pressure? So we can immediately predict, right, if we can make this alveolar pressure go down, we're going to make it less than the atmospheric pressure. Right, so we're going to end up drawing essentially a great big arrow towards the alveoli, driving air into the lungs. The next thing we can have happen is that we can have the lungs recoil. Seeing a question, yeah, the alveoli themselves expand. The question was whether the alveoli themselves expand or just get spread out. It's really that the walls of those alveoli are getting bigger. And we'll take a look at those walls and also the fluid inside the alveoli, like lining the edges of the wall in a minute. Okay, so the other thing that we can have happen, so we talked about the lungs being elastic and how they can recoil, right? They want to be a little smaller, essentially, because of their elasticity. So when the lungs recoil, we basically have this situation in reverse. So instead of drawing these out again, I'm going to draw an arrow to the left, right? So when the lungs recoil, we start out with a big alveolus. It recoils, it gets smaller, which means that these 3 molecules of air in here would get compressed again, increasing the pressure again. So as we have the size of the alveolus decrease, the pressure increases, which then will drive air out of the lungs, right? So again, we can think of this greater than, less than sign, even really just as an arrow, right? Telling us that that's going to drive air towards the atmosphere and out of the lungs. So here we see a graph, drawing this a little better and adding on some numerical expressions and some sort of displaying the curves that's happening as we're breathing in versus breathing out. So breathing in, inspiration, breathing out, expiration. So here we see our airway leading to the alveolus with our air molecules inside. We know that at rest, so at rest when you're kind of between breaths, right, that's when our alveolar pressure, or sorry, our atmospheric pressure is equal to our alveolar pressure. So that's what it's showing us at the beginning here, which is why our alveolar pressure is 0, because we remember that the relative pressure, which is what we track when we're thinking about inspiration and expiration, is the alveolar pressure minus the atmospheric pressure, right? And so if they're equal, you subtract one number from itself, you get 0. So that's showing us our starting point here. And what happens next during inspiration, right, is that our alveolus is expanding. It's expanding because our external intercostals are pulling the chest wall outward, making the chest itself bigger, right? If you breathe in, you can feel it, right? Your chest rises, it gets a little wider, maybe moves forward a little bit, right? So we are expanding that chest cavity, which means our volume is getting bigger, right? This alveolus is actually physically expanding, which means that the pressure of those molecules inside on the walls of the alveolus is dropping, right? So we're going down here at the beginning of inspiration. So we should be all good till there. The next bit might be a little tricky at first, right? So we then see that the pressure, even though we are still in this inspiration phase, we're then going to see that the pressure in that alveolus is rising back up. So what's happening here is that this isn't a closed system, right? We remember that our alveoli, right, they are attached to our airway. So unlike our container, like our imaginary container where we're thinking about the gas law, that we have a closed system that we compress and expand, the alveolus is open to the outside environment and we have air actually flowing in. So we can see that during the second half of inspiration, we're actually getting more molecules of air inside. So that's where that fact that pressure is directly related to our contents, right? The amount of something inside comes into play. Because now we're increasing this N, we're increasing the number of moles of air inside. So this is why our pressure is increasing as that air is physically moving. In the center here, between inspiration, between breathing in and breathing out, we are going to reach a point where, again, we return to this initial state. Our atmospheric pressure is in equilibrium with our alveolar pressure. So at that point, the relative pressure in the alveoli will reach 0 again, right? This is important because we are then, in order to breathe out, going to have to go from a situation, right, where in inspiration, our atmospheric pressure should be greater than the alveolar pressure. During expiration, we're going to need a positive number there, right, for the alveoli. So we're going to need to go to a situation where breath moves towards the atmosphere. So in order to get from this relationship where atmospheric pressure is greater than alveolar pressure to one where it is less than alveolar pressure, we're going to need to pass through a moment, again, where they are equal to each other. So we will continue tracking the breath here. So we pass this point where they are in equilibrium between the breaths, and our intraalveolar pressure increases because we are breathing out. As we breathe out, What's basically happening is that our chest wall is shrinking back. This is actually due to relaxation of the muscles, usually, unless you're breathing very forcefully, unless you are having to really try to breathe. This is the natural resting state of those muscles of the chest wall are at a slightly smaller volume. So we can see here our alveolus is shrinking, right? That's what these arrows are, which means it's compressing those molecules of air inside. So they want to escape because you're squeezing them, and they do it, right? So that's happening during the first half here. And we can see that they're shrinking even more. This alveolus is shrinking even more, but we now have less air in it. So the pressure drops because the air has moved out until we return to this state of equilibrium. Then we could go through this whole cycle again. So we have this kind of S-shaped curve, so a rotated S, right? So we have this curve for our intraalveolar pressure. But if we were to look down at this curve for breath volume, so the amount of air in the lungs, right? So if we were to just graph, instead of graphing the pressure in the alveoli, we were to just essentially graph the N, right? So just graph the amount of air in the lungs, we would see that during this whole phase of inspiration, we put in more air. And then during this whole phase of expiration, we put in less air, so air moves out. So the breath volume curve is just a dome. Questions about this diagram here? I know a lot's going on, but hoping this made sense. Okay. Great. So the mechanics for changing the volume of the alveoli largely through the muscles of the chest wall and the elastic properties of the chest wall. So our inspiratory muscles are the diaphragm and the external intercostals. So the diaphragm is naturally dome-shaped. As it pulls tight, it becomes flat, which makes the thorax bigger. And our external intercostals pull the ribs out to the sides. So you can feel as you put your hands on your rib cage, as you breathe in, your ribs are moving out. So they're becoming wider, a wider thoracic cavity, and you also have them moving up. So making a deeper thoracic cavity due to the rotation of the ribs by the external intercostals. There are muscles related to expiration. So you can use your internal intercostals, which you should have noted in lab, have the opposite fiber direction of the external intercostals. So they move the ribs the opposite direction. They pull the thorax tighter and smaller. Or you can use the abdominal muscles, right? If you put a bunch of pressure on your guts and your liver, they're going to have to push up somewhere. They'll push up into the thorax. So you can do this in forceful breathing, but usually expiration just happens when your diaphragm relaxes and goes back to its dome shape, and the external intercostals relax, so the ribs go back to their original position. Okay, so this is just taking a look at the muscles that we could use. So here we see the natural dome shaped the diaphragm. Here we see the external intercostal muscles. So that's what would pull the rib cage out, right? And the diaphragm would expand the kind of top to bottom volume here in the thorax. So here on the left-hand side of this diagram, they've labeled our muscles for inspiration. And on the right-hand side, they've labeled our muscles for expiration. So our internal intercostals could draw those ribs down and together, making the thorax narrower. Our abdominal muscles could push that diaphragm up by pushing your abdominal organs towards the thorax. So here we see what this would do if we take a cross section, right, like a horizontal one through our chest wall. So essentially what we're doing is we're taking our dotted line here right? If we make a cut and then we look down, right? So here's our vertebrae, here's our sternum. So we can see the chest wall and lungs expanding during inspiration, and we can see that volume getting smaller during expiration. So what we're going to go through now is just the whole flow of what's going on as we're controlling the breathing. So we're going to start our breath through neural stimulation, right? So this can happen unconsciously, but you can also consciously control breathing, right? Unlike heart rate, right, which you couldn't really control that well, we can control breathing. So we're going to have neural stimulation of the inspiratory muscles. And those nerves are going to run down to the thorax. They're going to tell that diaphragm to contract. You may have seen the phrenic nerve in lab, and if you haven't, you'll see it during our next lab cycle. So telling the diaphragm to contract, right, flattening and moving downward. And then also nerves running to our external intercostals, telling them to contract, making the ribs pivot up and out, expanding the chest. This expands the volume of the thoracic cavity, and since we know that our pressure is inversely proportional to our volume, right? As we expand our volume in the thoracic cavity, that means our pressure is dropping down, right? Because they're opposites of each other, okay? So as that's happening, we also are having an outward pull on the pleura. So if we're looking at the intrapleural space between the lungs and the chest wall, right? So let's have our lungs. I'm not going to draw the tubes that well right now. Right. Here we have our lungs, here we have our chest wall, right? And we got the space between. So that intrapleural pressure, we remember, is the pressure in this space, right? So the intrapleural pressure, as the chest wall pulls away from the lungs, drops down, so it becomes more negative, meaning that our transpulmonary pressure goes up, because we remember that we subtract this intrapleural pressure when we calculate the transpulmonary pressure. So we subtract a negative. If we subtract a more negative number, this transpulmonary pressure goes up. And the alveoli are expanding, basically because of this pull on them outward, this pull by the chest wall as expressed by this transpulmonary pressure. So our alveolar pressure is going down, again, because whether we're looking at the volume of the thoracic cavity or the volume of a single alveolus, this relationship between pressure and volume stays the same. This is a law, right? This is just physics, or yeah, I'm going to call it physics. You might call it chemistry. But this stays true for an individual alveolus. So as their volume is increasing, the pressure is dropping down. And so then the air flows into the alveoli by bulk flow being that equation of our flow equivalent to a pressure difference divided by resistance. So in this case, our atmospheric pressure minus our alveolar pressure is our pressure difference, our pressure gradients, divided by resistance. So this is the whole thing that's happening as we run through a single breath. Which means that your book also has a flow chart for this. So we can step through this as well. This is basically that's saying the same thing we just said in those bullet points in words. So we have our motor neurons increasing their neural input, right? So we're sending action potentials down those nerves. They're going to our inspiratory muscles, so to the diaphragm and the external intercostals, which contract in response to these action potentials, right? So we have acetylcholine at the neuromuscular junction, so our muscles are contracting. This means our chest wall is expanding because the diaphragm is moving down, flattening, so basically making the thoracic cavity taller, while our ribs are pivoting up and out, making that thoracic cavity wider and broader. This means that the intrapleural space would be expanding, except we're holding that wall of the lung to the chest wall using that fluid in the intrapleural space. So we're creating a pull on that intrapleural fluid, which is therefore exerting a pull on the lungs to move with the chest wall. We can express this and confirm this by seeing that as we pull on that intrapleural fluid, our intrapleural pressure goes down, right? So it becomes more negative, so it's a greater pull outward, which means we have a greater transpulmonary pressure because we subtract our more negative number in order to calculate our transpulmonary pressure. Overall, this leads the alveoli to increase in volume because they're getting pulled out, so their walls are getting pulled out as well. Because pressure is inversely related to volume, the pressure in the alveoli drops down. This means that as we compare this pressure gradient, pressure of the atmosphere minus pressure of the alveoli, our pressure gradient there increasing, which means our airflow is going into the alveoli. And we have a little baby negative feedback loop here because as we have flow of air into the alveoli, we are then increasing the pressure in the alveoli because pressure is directly related to our volume, or I don't want to use the word volume, so our number of moles of air in the lungs, so our N, right? We have a direct relationship there, directly proportional. Okay, so all of these arrows would then reverse themselves until we get to a point of equilibrium between the atmospheric pressure and the alveoli, sort of the center or top of our breath before we then breathe out, before we exhale. So we could track some of these again using some more graphs. We're trying to emphasize graphs here. Being able to look at figures and figure out what's going on, super useful. The more you can understand figures, the less you can read, honestly, if you're trying to look at scientific papers or, medical information. If you can look at a graph, a picture's worth 1,000 words. So if you can figure out what's going in a graph, you don't have to read those 1,000 words. So here we see our breath volume, all right? So this is familiar, we saw this before, increasing during inspiration, decreasing during expiration. So that's our air in the lungs. You can see this, our breath volume here measured in liters, right? And now we are also looking, I'm gonna move my annotation controls because they're covering stuff up, okay? So at the top, we're looking at a single alveolus. So we are looking at comparing the atmospheric pressure, so out in the environment, compared to the alveolar pressure, right? So we know that that tells us the direction of airflow, and we can express it as a gradient for our equation for flow, so atmospheric minus alveolar pressure. This outer bubble here, this is sort of abbreviated cartoon form of our chest wall, right? So we simplified this. We didn't draw a whole chest, we just drew a circle, so that we could also express the transpulmonary pressure, which is essentially the pressure across the wall of the alveolus, so expressed by the pressure of the alveolus minus the pressure in the intrapleural space. And we could then track how these change as well during inspiration. So this top line here is the pressure in the alveoli. You can see it's going down during the first half of inspiration, then increasing during the second half. And then during the expiration, we have the reverse of that curve. If we looked at the pressure in the intrapleural space, you can see that that pressure is decreasing, becoming more negative as we breathe in. But then as our chest wall relaxes, and recoils inward, it goes up. All right, sorry guys, I know we're a minute over time. This is a great stopping point anyway, so we'll pick up here on Friday.